Magandang araw po sa inyo lahat. Pag-uusapan po natin ngayon ay tungkol sa mga recommendation regarding insulin injection technique. Just a disclosure, this lecture is not paid by any pharmaceutical company. And then our objective for this session is for you to appraise the recommendation on insulin injection technique. First and foremost, before you start teaching your patient about injection technique, you have to assess first the barriers to non-compliance. Kailangan po nating malaman kung meron bang agam-agam ang pasyente natin, kung meron siyang hindi naiintindihan tungkol sa insulin. We have to address everything. You have to dig deeper. Use different approaches in order to elicit a lot of information with regards to barriers of insulin injection technique, especially the actual insulin injection. Then, during the follow-up visit, if you're the diabetes educator, please allow your patient to follow up after a week so that you will be able to assess if there is any further barriers or concern regarding the technique. If you need to observe again the patient on how they are doing the insulin injection, you have to do it. If you need to repeat the instruction and observe again, do it. This will ensure the possible adherence to our treatment, especially for the injection. If the patient is using a cloud insulin, which is your NPH and your premixed insulin, you have to teach the patient to resuspend the insulin before they're going to extract it and get the insulin into the syringe. You have to resuspend. If you need to demonstrate it to the patient, demonstrate it and then let the patient demonstrate it back to you, so that you will be assured that the patient is doing it right. Next, prior to injection, patients should be instructed how to examine the insulin. This is very critical to ensure that there are no changes in the insulin, there is no clumping or frosting, or there is no alteration in the color. Which, if they are going to see that, please tell your patient not to use the insulin anymore. For the storage of our insulin, it is recommended that the insulin not in use should be placed in ideal temperature, which is 2 to 8 degrees centigrade, which it could be placed in the lower part of the refrigerator, which is in the vegetable compartment. We encourage the patient to place it first or to put it first in a container which is clean so that it will be well protected. If the patient is using the insulin and it will be consumed in a month time, it's not necessary to place the insulin in the refrigerator as long as the patient is assured that the insulin is at 25 degrees centigrade in a room temperature. If there is no refrigerator and you want to be assured of the coldness of the area, patient could be advised to use a clay pot, or in our own dialect, it is palayok. Pwede pong gamitin ng palayok para i-store ang ating insulin. In removing air bubbles, before using the pen, you have to do the priming with the 2 units of insulin so that you will be assured that the needle is potent and there is no air bubbles inside the pen. If you are using a syringe and if you see a bubble like this, the one pointed there, you have to tap the barrel and then push back the insulin into the vial and slowly pull the plunger so that the air will not come inside the syringe. Please never use or reuse your pen needle or your syringe. It is not recommended to reuse the pen needle or syringe. Sharing of needles are never acceptable. Please do not advise your patient to reuse your syringe and or pen needle. It's advisable, again, not to reuse needles. One of the side effects of insulin therapy is hypoglycemia. All of us healthcare professionals should teach our patients with regards to signs and symptoms of hypoglycemia, the causes of hypoglycemia, and we have to teach them how to address this hypoglycemia at home. There are some examples of 15 grams of carbohydrates that could be taken when the patient is experiencing hypoglycemia. A half cup of 4 ounces of any fruit juice, a half cup of regular soft drinks. Never give diet soft drinks because there is no sugar for that. 4 to 5 pieces of hard candy should be crushed so that it could be easily dissolved in the mouth of the patient, and 1 tablespoon of sugar dissolved in small quantity of water. Remember, this 15 grams of carbohydrates is simple and easily absorbed as sugar so that it will address the hypoglycemia. Please do not give the patient a complex carbohydrates during the episode of hypoglycemia. Do not give also chocolates because chocolates has a lot of fats which delays the absorption of sugar. Now, injection site disinfection. The skin of the patient should be clean and dry before the injection, especially if the patient is inside of an area where we are not sure of the cleanliness. But if the patient is in the house and assured of that the area to be injected is clean, usually disinfection on that particular area is not anymore required. So they can inject directly to the skin fold without any disinfection of that particular area. We have to teach the patient also how to inspect the insulin site, and if there is signs of lipohypertrophy, inflammation, and edema, or sign of infection, please advise the patient to rotate the injection site. So what is lipohypertrophy? Lipohypertrophy is a lesion in the subcutaneous tissue wherein it's like a rubber-like, and it is hard and you can palpate that particular area. The one in the picture is easily observed lipohypertrophy, but sometimes the lipohypertrophy, you cannot see it, but you can palpate it. In that case, you have to tell your patient not to inject in that particular area because you need a high quantity of insulin because of non-absorption in that particular area. Please do not use that particular site for injection. Patients should be taught on how to palpate the area so that they will know exactly if they're going to use that particular site for injection or not. We are recommending different parts of area to be used. For in self-injection, you can use the abdomen and the thigh. But if the patient is to use the arm and the buttocks, it is recommended that a third person should be the one to inject in that particular site. So rotation of injection site. It is already recommended that you are going to rotate. So in the abdomen, you have to have 4 quadrants. Use one quadrant first, and then second quadrant, third, and then fourth. What do we mean by that? The first quadrant, the site should be measured 1 centimeter away from each other. And how to start it? Please avoid or measure from the umbilicus or umbilical area 1 to 2 finger breadths away from the umbilical area, and then you start injection there. And then the injection should be 1 centimeter apart from each other. Use first the first quadrant, maybe for a week, and then second quadrant for the next week, third, and then fourth quadrant. Why are we going to do that? So that after a week of using one quadrant and you are going to the next quadrant, you are resting the first quadrant, and so on and so forth. Now for the thigh, of course, you divide it by 2. You have 2 thighs. 1 quadrant, second quadrant. Maybe you can start on the left and then go to the right. Then, as what I have mentioned, in each quadrant, you have to space it 1 centimeter away from each other. The healthcare professional, always, whenever the patient is going to have a checkup with you, please verify if the patient is rotating the injection. Now, what is the skin fold or lifting the subcutaneous tissue? With the use of your thumb and the index finger, you pull the skin and subcutaneous tissue from the underlying muscle. Why we are doing this is to avoid hitting the muscle whenever they are going to inject the insulin. These are the recommendations if you are using different length of needles to be used. Example, if it is children 2 to 6 years old, you can use the 4 mm right angle, but with a skin fold, and so on and so forth. Injection recommendation for special population. Now we go to children and youth. It is recommended to use the 4 to 6 millimeter needles, and the skin fold is recommended for 2 reasons: to ensure that the insulin being injected is in subcutaneous, and also sometimes we're using the skin fold to divert the attention of the children or the youth or the young people, because sometimes even if they are using the insulin for a long time, sometimes they are afraid to do that, and using the skin fold may divert the attention of the children or the child. The child, sometimes we have to address some of the barriers through collaborative team approach. So, sino po yung mga tuturuan natin? Who are the people who we should teach also about the insulin therapy and about diabetes and how to manage hypoglycemia? They are the parents, the school teachers, especially the nurse in the school, the friends, the close friends of the patient, so that they will not be afraid if the patient is not feeling well or addressing, or if the patient is having a hypoglycemia, they can easily recognize and help their classmates, or they can help the students on how to manage the hypoglycemia. For the pregnant women, of course, close monitoring and dose adjustment are very important. So our diabetes educator should be well aware of that. So common questions to be asked: can we use still the abdomen? Of course they can use, but with skin fold. And avoid the umbilical area, especially if it is being protruded already. And so advise also the patient to go lateral, more lateral, and be sure that they can do the pinch up or skin fold before the injection. For the elderly, we have to assess the capacity of the patient to still inject their insulin by themselves. And maybe you can recommend first, initially, you use the insulin pen because it is easier for them to use. And of course, educate the caregivers or the one who is caring for the person, the relatives or their kasambahay, if they have, who are frequently there beside the patient. Also, you have to teach them on how to address the hypoglycemia because sometimes patients, especially elderly, will not know it. So if the caregiver is aware of the signs and symptoms, they could easily address the possible side effect of the insulin injection. Now we have to assess also for the hearing impairment or vision impairment and the dexterity of the patient. It's very important to do that so that we will know exactly on how to manage and how to teach the relatives on giving insulin. For those who have hearing impairment, it's advisable that whenever you teach the patient, you have to be face-to-face. If the patient is going to have a self-injection, and if they can do it, instruct the patient facing each other, or maybe you can use a sign language or demonstrate on how to use the insulin, even if it's pen or syringe. Teach them slowly, and when you are going to teach, and there should be a teach back method or a return demonstration so that you will be assured that the patient is following the right technique. Now for the lean and obese, it is also recommended that they can use 4 to 5 millimeter of needles. For the lean patient o yung sobrang payat, skin fold is necessary to ensure that the insulin will hit the subcutaneous tissue. Following this short lecture on the recommendation is the insulin technique to be demonstrated to you by our young leader, Ms. Jessica Villanueva. Thank you and enjoy watching the video.